Hello, good evening, girls. This is Dr. Amrit Kaler. As you all know me, I'm a pathologist and an international beauty pageant winner. I'm here to talk on a very important topic, that is the prevention of cervical cancer. As I have discussed in my previous lecture, that not only the disease but also the stigma of carrying the disease is something which we need to address on. And because as a woman, diseases, it really takes a toll down on them when we think that we are sick and we feel helpless about it. So the main important point which I want to specify here in the cervical cancer prevention is the prevention of the infections. In the breast cancer, I have specified on the hormone estrogen. In this, along with the estrogen hormone, I will be specifying on the cervical health by infections. There are so many sexually transmitted diseases which are common. I don't have to name them, like gonorrhea and chlamydia, but there is another one, viral infection known as HPV virus infection, which usually leads to the cervical cancers. So I don't need to specify a little more on the other infections like chlamydia and gonorrhea, because they can be easily treated with antibiotics or antifungals, and they can be treated, or sometimes like Candida is easily treatable. But the viral infection like HPV, it happens, it is transmitted, is a sexually transmitted disease, but if it persists in a woman for more than 20 years or even more than 10 years, in a sexually active woman, and she's involved with the multiple partners, it can, there is, the statistics says a less percentage, but it can lead to the formation of cervical cancer. So let's talk about, as usual, let's talk about the risk factors, and then let's talk about the prevention of the risk factors, and then what is the treatment available, and what are the different vaccinations which are available nowadays. So among the risk factors, multiple sexual partners is the first and the foremost important part to be recognized, because early sexual activity, like a teenager increased sexual activity, also if you are associated with the multiple sexual partners, the chances of getting the HPV infections are more. So hence more chances of getting into a cervical cancer. So if you're getting married earlier in your community, or if you have early sexual partners, obviously you are at a risk of getting a cervical cancer. So this is about the spread of the infection. Then we have the lifestyle factors, as usual we have spoken about. We need to have the alcohol, and we need to avoid smoking. These are very, very bad risk factors which need to be addressed too, because these are the basic factors responsible for any type of cancer, let it be lung cancer or cervical cancer. So lifestyle factors, environmental factors are very, very important. If you exercise, if you don't smoke, don't drink, I know this is an ideal situation, but everything in moderation will be really, really helpful. And then they say estrogen also, if you're on oral contraceptives, also they say there are more chances of getting a cervical cancer. Again, the reason remains the same, that the more estrogen, more chances of proliferation of the cells in the cervix, and this leads to the cancer. And also there is a diagnosed effort that if you have multiple pregnancies, or if you have multiple children and you deliver multiple babies, this also leads to more chances of cervical cancer. So late marriage, utilize your time in studying or working and standing on your feet. Okay, marry only when it is when you are confident enough that you will be able to take care of yourself. And late marriage, that's what I mean. And then being with only one partner, and also having 1, 2, 3 pregnancies. I think this is are the ones which are normal things which prevents the formation of a cervical cancer. So there are different techniques which are available. There are different I'll talk about it later, but let's start up about the prevention of the cervical cancer. How do we prevent it? First one is there's a vaccine available nowadays known as Gardasil, which can be given in the young women, teenage girls, after the age of 10 years, probably before they start with the sexual history. So if we give them these vaccines, the chances of getting the HPV infections are very less. So I advise all the women who haven't started the sexual activity can take that vaccine. It's like 0, 1, 6 months. The 3 doses are given, and the trade name is Gardasil, and that can drastically reduce the cervical cancer. Now, if you are not vaccinated, now how to prevent it? That's the most important thing. Now, the prevention is the pap smear, and I'm sure everybody of you have heard this name. Pap smear is a very important technique in the prevention of cervical cancer, and the WHO says before 30 years, every 3 years you have to get a pap smear. And I'm telling you, pap smear screening has reduced the incidence of cervical cancer from up to, I can say, up to 50 to 70%, because the early screening and the early diagnosis and the treatment, because you don't have to go towards the advanced treatment of hysterectomy by radiotherapy and chemotherapy. So make sure all the women out there, they get their pap smears done every 3 years. But now, if you are 30 above, I think along with the pap smear, you have to screen for HPV infection if and only you see some atypia or you see some indeterminate category of pap smears like L-cell, H-cell, and if there's an abnormality, basically you should go for HPV screening as well. Alright, so I've said HPV screening is not a diagnostic thing that you will get into cancer, but there are chances that you will get into cancer, that you might get into cancer. Okay, so this is what WHO recommends from 30 to 65 years of age. You do the HPV screening when and what required, depending upon the availability and depending upon your pap smears. But if you're more than 65 years, I'm sure you don't need to do the pap smear unless and until you have any abnormalities. Okay, so let's talk about the abnormalities here. What are the symptoms, signs and symptoms which are important when you should approach your gynecologist or a surgeon that this is something happening. So the thing is, you have to look for fouled discharge, the foul discharge or a thick discharge, or if you have a spotting between the intermenstrual period, if you are feeling that that the bleeding is not related to the menstrual cycle, and also if you have a post-coital bleeding as well, after sex, if you have a bleeding, and if you're getting a thick discharge, heavy discharge with the bleeding, and there is a pelvic pain and also there is a back pain, so that is a time, or sometimes you will have a loss of weight. So these are the few of the symptoms that you need to keep a check on yourself to prevent cervical cancer. So so after 65 years, if any of these symptoms appear, then only you need to get a pap smears. Otherwise, the WHO has recommended that up to only 65 years, you need to regularly check every 3 years with a pap smear and HPV infectious testing. So fortunately for all of us, all these tests are available in India. So, and we just need to prevent and protect ourselves. You might be surprised that I am doing a screening of cervical cancers in the rural Bangalore. So we have a team with tie-up with the Sahaya Ahasta, and then we go to the rural area of Bangalore and we actually take up samples for the pap smear from all these ladies who never get a chance to do the pap smear, and we are able to provide them early diagnosis and treatment. So it's not only you, it's that you have to provide it to the people around. If you have this information, if you have this knowledge, please spread it around so that you can save one more person or one more lady from another shock and another death. So I think I have given you the complete information about the prevention, and then the treatment is based upon whatever report you get after the pap screening. But for you, till now, get your pap smear every 3 years and make it a habit. I'm telling you, prevention is better than cure, and there is nobody else who can take care of you than yourself. So this is why I'm wearing this shirt here. It says be your own hero. So for this video I just wanted to leave a message that be your own hero, be yourself, take care of yourself, and help all the women around, your mother, your sister, your daughter, and your daughter-in-law. I mean, these are very, very important, and I mean, I have always been very careful about my mother-in-law too. So as a woman, we have to be with each other, stand by each other, because this is what is women empowerment. It's not about putting the men down and pulling the women out that we are better than men. No, it's just standing for each other, and that's what I believe in. And if you have the information, you have to spread around and help each other when they are in need. And I'll tell you, I promise you that if you do it, the God will help you in multiple ways. That's a promise. All right, I think I've spoken quite a bit today, and I might be able to see you in the next session. And if you want me to talk on any more topics, just hand it over to Richie, and I think I would be very, very happy to take those topics and talk about them. And if you have any questions, you can leave it to Richie so I can respond them back in my next session. So remember, this is Amrit signing off, and hope to see you soon, and wish you all the best to you guys. Bye bye.